Good evening, everybody. Thank you very much. All right, awesome. So tonight's program is an MS Views and News program. This is our MS Summit 2024. I want to thank our sponsors for today. That's Viatris, Sandoz, and Novartis. I hope that you could all give them a round of applause and say thank you. All right, tonight we have Jessica Thomas. Jessica Thomas is a licensed clinical social worker. She's the director of patient education at the Neuroendocrine Tumor Research Foundation, and the facilitator of MS Views and News monthly mental wellness chat. Jessica brings nearly 2 decades of experience as a licensed clinical social worker, specializing in helping patients and caregivers in neurology, oncology, and chronic illness.
Good evening, everyone. So my name's Jessica Thomas. As Stuart had mentioned, I always like to tell my story in these 4 numbers, and every year the numbers change. But 20 is the number of years that I will have been married this year. 19 of those years I've been living with MS. Out of 18 of those years, I've been helping people live with disease. And the type of help that I do is the emotional wellness piece of it, the mental health piece, the piece that's invisible to many. And then 17 is the year that my son turns this year. So that just tells you a little bit about my story. Okay, so we're going to talk about mind over matter, stress management, and the role that stress plays in MS. And I'm going to try to do this in 25 minutes. So we're going to move to our next slide. And I'm not going to belabor this point, but stress is not good for MS. How many of you knew that already? Okay, if you're living with MS, you often know that you can think about a period of time in your life where things were really stressful, and you probably could attribute to your MS symptoms not being as good. You might have attributed having an MS relapse. Stress doesn't cause those things, but stress absolutely does not help those things. So stress is really the physical and mental response to the external trigger. So what we had then is we have things that happen in our lives, and they're called stressors. And those stressors cause our reaction, which is stress. So it's important to know about the difference, because we cannot control that there are going to be stressors in our life, but we absolutely can control some of our reactions, some of our responses, and how we react to stress. So what is the stress cycle? The stress cycle is essentially a 3-part cycle that we want to make sure that we close out and that we deal with. Stress happens every single day. Positive stress, negative stress, good things, bad things. Probably getting here for some of you is stressful. And we'll continue to have stress, good and bad, every single day. So we want to learn how to cope and deal with stress so when we don't become the tropical storm, because we don't have to be the tropical storm. We can learn how to work with our stressors. So each stress cycle has 3 parts: alarm, resistance, and exhaustion. So alarm is the thing that happens when you react to something. So say that you receive a email that you need to do something, or you missed doing something, and that initial response or that reaction, or you get a phone call and there's a voicemail and it causes a little bit of a reaction. That's that response to a stressor. A long time ago, in the caveman days, it might have been that sense of alarm could come from being chased by a wild animal. But for us, it's things like getting emails and talking to people and having a to-do list and other things that can cause that sense of alarm. So what happens during that state of alarm is that your cortisol goes higher, and this increases also your blood sugar. and the purpose of that is to provide more energy to the muscles, and adrenaline increases your heart rate. So your body kind of reacts to stressors. And then once that initial threat subsides, because when it's just an email, it's just an email, right? If it's just a task, it's just a task. Our bodies will learn we're safe. Eventually, our blood pressure will reduce a little bit. Our cortisol levels will drop, and we will feel a little bit better. But what happens is if this is a chronic stressor, that we continue to have the dysregulation of these emotions, and so the cortisol, it stays higher and stays longer, and that's not healthy for us. It's inflammatory. It's not good for our body. It's not good for our sleep, and it's not good for our concentration, and it's not good for our moods. So if the stress remains, and you can't complete the stress cycle, then the body repeats this process, and then you constantly are sort of in a state of alarm, and then a little bit of relax, but not really full relax, and it's not healthy for your body. So how can we close out the stress cycle? I think of stress like waves. I also think of anxiety like waves. Comes and goes. So stress can be scary, but the good news is there's a lot of effective things that you can do to help manage it. And we're going to go through some of these specific things that you can do. So the truth is, mind over matter, you have some control. How many of you guys like to be in control? I love to be in control. And that was probably my biggest thing that was difficult for me at my diagnosis of MS, as I realized all of a sudden I wasn't in control of everything. And so learning that there are things that you can be in control of is incredibly important. So you have some control here. First one, sleep. Let me introduce you to Charlie. He's my puppy. So Charlie looks like probably a lot of people sometimes at bedtime. We're really tired, we're really exhausted, and we cannot fall asleep. Often when we go to lay down, that's when our mind starts going, right? And we start thinking about things. Finding a good way to increase your sleep hygiene is important. I always say talking to your doctor. If you're having difficulties, challenges, problems with sleep, this is important. There's things that you can do to help manage your sleep, things on your own, like having a bedtime routine, and talking with your medical provider will help with that. Also, you can talk with a counselor. I won't go through all the strategies, but managing sleep will help manage some of your stress level. I know for myself, and I will always talk about myself because this is something I understand. If I don't have enough sleep, I'm not as emotionally resilient. So, and that's true for all of you guys too. If you have a lot of sleep, you have the ability to recover, you can manage stress better. Now, the next thing we're going to talk about is releasing emotions. Closing out the stress cycle, finding ways to vent, to let go of some of the stress from the day. There are lots of different ways that you can do this, and you may have different things that you do to release emotions than I would. Some people might go running, some people draw, some people journal, some people might have a conversation with a friend. The point is that we have to find ways to let go of the day, let go of the stress. At the end of the day, the body keeps the score. It's the name of a book. It's a really good book, by the way. But your body does keep the score. And so we've got to find a way to let go of whatever the stress was for the day. And then we want to find ways to cope. This is just a picture I use quite a bit especially when I was doing therapy, one-on-one therapy. And it's a volcano. We have lots of volcanoes around us, all over the country. And volcanoes don't always erupt, but they do erupt sometimes, right? But we don't know when they're going to erupt. And we're like volcanoes in many ways, too. We can get to that tipping point where we've just had too much. So what I think is really helpful for stress management is thinking about what are the things that can help vent off some of the pressure that you've experienced, either through the day, through the week, through the year, etc. Because if we don't find things to do to release the pressure, then it builds and builds and builds. And then that's when things kind of get out of control, when stress feels too much, when life feels too much. Setting limits. This is something that can help you if you're having a very stressful day. Grab a pen and paper and write down what are the priorities here. It doesn't mean that everything's not important. It's just that you are prioritizing what is important to you and what needs to be done. This gives you a sense of control. And then we're going to move on to micro practices. And what I like about micro practices is just this. How many of you feel like you don't have enough time in the day to do the things you need to do to take care of yourself? Be honest here. Like, I feel this way sometimes. And it's hard to figure out how can we, work in things. If I have doctor's appointments, I have work, I have things I'm volunteering for, I have my friends, I have my responsibilities. I can't do this. I can't take care of myself. Well, one, you can take care of yourself, but there's also small, tiny things that you can do. Small things make big changes and big differences. So we're going to talk about micro practices. And micro practices can be short and very brief, can be as little as 20 seconds long. And they're just a way to for you to take care of yourself and to respond to a stressor and to give yourself to pause a moment. So we're going to practice a little bit. So this is a micro practice. We're going to do some deep breathing exercises. So for this, we're going to inhale for a count of 4. And then we're going to hold our breath for a count of 4. We're going to exhale for a count of 4. And then we're going to hold for a count of 4. We're going to do 2 sets of this. And essentially, it's going to draw a box. I call this box breathing. Other therapists call it different things, but this is a really good way to kind of reset and refocus. So we're going to start here by inhaling for a count of 2, 3, 4, then hold for 2, 3, 4. Exhale for 2, 3, 4. And hold for 2, 3, 4. Inhale again for 2, 3, 4. Hold for 2, 3, 4. Exhale for 2, 3, 4. And then hold for 2, 3, 4. Just a couple seconds. But if you can do that, it can help to reset you and to feel a little bit better. There's also a self-compassion exercise that I love. Another micro practice. So for this, I think sometimes we often don't give ourselves the compassion that we need and the love that we need and the self-care that we need in moments that we need it. This is a very small, short activity that you can do. And what I want you to do is I want you to take your hand and gently place it over your heart. And then one hand over your belly. So you're almost hugging yourself. And it feels good to get a hug sometimes. So what we're going to do here now is we're going to take a deep breath in. And I want you to feel the connection between your hand and your body. I want you to take a deep sigh out and notice the movement, the sound, the temperature, the sensations. And now we can also allow ourselves to have a compassionate affirmation. In this moment, we may say, I give myself room and comfort. I feel the warmth that I can offer myself. I take this time to appreciate who I am. I accept and love myself. I am gentle and understanding with myself. I do not have to be perfect. Whatever it is that you need to hear in those moments. But we can take 20 seconds in our car, by ourselves, and show ourselves compassion. Next for micro practices, brain breaks. This is actually not a technical term. It's a term I use all the time, though. If you were to speak with my employer and she'd say, and ask them, what is something Jessica does to take care of herself? And she'd say, brain breaks. So brain breaks for me may be something that could be similar to you, but I think that they're very helpful. Walking away from stress and chaos, finding maybe 1 or 2 minutes that you can take for yourself. Sometimes I color. Sometimes I just go sit on my porch. Sometimes I just close my eyes and listen to birds. Whatever it is that you need to do to take a brain break sometimes, take a brain break. That can help you to feel reset again and come back to the task with more energy and more clarity. And then there's grounding. So some of my examples have some qualities of grounding, but grounding can literally be standing in the grass with your shoes off. It's a very cleansing feeling. It's a very good feeling. Also, grounding can be a practice where you are paying attention to your sensations. You know, thinking about what are 5 things that I see right now? What are 5 noises that I hear? Just thinking about all the senses that you have. Can you incorporate them into what you're doing? And that can be done as a micro practice. So mind over matter. Managing stress is possible. We can't take away stress. It's going to be all around us all the time, in good ways and bad ways sometimes. But it's so imperative that you find the tools that work for you, the big tools, and then also the small micro practices, so you can live well with MS. And this is a part of it too. Living well emotionally with MS is as important as living well physically with MS too.
In your introduction, they mentioned a weekly mental health chat. Is there a link or information on that?
So there is a monthly mental wellness chat. How many of you are familiar with it? Okay. How many of you have ever attended it? Thank you. Okay, so I highly recommend signing up for it. What I have is a flyer over there with a QR code. I am going to make sure that I personally bring it to each table, and everybody can scan it if they want to sign up for it. This mental wellness chat is incredibly cool. We've been doing it for, goodness, like almost 3 years, 10 months or something like that. And it's become quite a community. So we have a monthly topic. And my favorite part about it is that I'll ask questions to the group. And you guys help each other out. And you become a part of the community. You have to really sign up, see what it's about. But we have a lot of people that are on month to month, every month, and it's a great community. Thank you for asking, and I will be at every table to share that.
Thank you. And I'm going to answer it even a little bit further, right? Because there are people online asking it as well. So if you go to the MS Fusion News website, you can write it down, msvn.org, www.msvn.org. All right. And you go to where it says join us, and you just go online and you just get registered. All right. You go into that tab, and then you'll see our events. And there are online events. Those are the virtuals, and there are in-person events, which is where you are right now. But you could just sign up for the virtual events, and you'll see the mental wellness chat will open up, and you just get signed up for that, all right? Also, for those that are online, you could just go to the website and just get signed up for it by again, going to where it says virtual virtual events. But also, you can go to our YouTube channel and you could see what Jessica has spoken about in the past, because you can go to our YouTube channel, which is simply www.youtube.com/MS Views and News. Right. Like you're all going to remember that, right? So bottom line, go back to our website and find the button for the YouTube channel. Go to the YouTube channel, all right, and then just click on it. Get in there and go to the search bar and just type in Mental Wellness Chat. And then all of Jessica's programs that she's done for us over the last few years will pop up so you can see what's there and you can watch at your own leisure of what you want to do, for, watching part of the program or watching the whole program. It's up to you, or however you want to get it done. All right.
And next month, we're going to be talking about how to talk about MS to other people. And I think that's a topic that comes up a lot because a lot of symptoms are invisible, and it's difficult to talk about sometimes because not everyone understands what you're going through. So we're going to be focusing for our June program on that, talking to people about your MS.
All right. For all those that are online, I just typed in the link to our website, and again, you just go to the website. And again, most easiest thing for you to do is to click on the box that says YouTube channel, all right, and you'll get to the YouTube channel. And again, you go there and you find where it's Mental Wellness Chat. And for everybody that's in person, you got the emails from me, and at the bottom of that email somewhere is our website address, and you can just more easily find it from there. So another question for you, though, is people want to know specifically what can you tell them about depression and multiple sclerosis?
So depression is often a significant part of many people's journey with MS and mental health issues, as well as depression, anxiety. It is often comorbid with the disease. I know for myself personally, I've dealt a lot with anxiety over the years, and that's like a cousin to depression. But depression is something that it's important to talk with your healthcare provider about because depression is treatable. There are resources such as counseling, cognitive behavioral therapy. There are medications. There are tools and resources and strategies to help you manage depressive symptoms. Now, if we go and have depression untreated for a long time, that impacts your quality of life to a great degree. And this is something that we can control. We can help to manage some of the symptoms of depression. Now, will it mean that depression is always, a part of your journey with MS? Possibly. I say I have anxiety like I have brown eyes. I've just accepted it's a part of my journey. But treated anxiety and treated and managed anxiety is much different than unmanaged. And so that would be my hope for depression as well.
Next one is, how do we talk to our families about our MS?
Okay, so what I'm going to say for starters is to join in on our next mental wellness chat because we're going to be talking about that. The other thing I would recommend is to include your family, your friends, your loved ones, people that care about you, to get to come to programs like this in person and online so they can learn. I think the in-person is very special because I know early on in my own disease, I would have my husband come with me to some of the programs because I wanted him to meet other husbands too. And because they would have something in common. They both had spouses that were living with MS. And that helped for my own journey. But if you're struggling with learning how to talk to about your MS to people that you love and that you care, I think education really does help. And I encourage you to sign on to next month's Mental Wellness Chat. I'm not going to give away all the spoilers here.
Okay, next one was, since you're talking about family, person wants to know, saying that she's tired all the time and she can't take care of her children. Daddy's at work and the children want to be played with. What do I do?
Okay. So we have, I know in the past we've done some mental wellness chats on parenting with MS. I do remember. So I want to shout out to go to the YouTube channel and look for that. The second thing is it depends on the age range of your children, right? Because how we respond, how we talk to our children about our energy level, about our disease, about our symptoms really varies depending on how old your child is. But it is important to talk about, and it is important to integrate MS is a part of your family. I always said my husband and my son don't have MS, but they have MS because it's a part of their life, and it's been a part of their life for my son's whole entire life, and it will continue to be a part of my family's life. So finding ways to work together. There are counselors that work with children specifically that might be able to help, and I can't give very specific information to the response to the question because I don't know the ages of the children. But the important thing is that integrating MS as a part of the family, not the core of the family, but a part of the family, and finding ways to work together.
Awesome. Any questions? Then I'm sorry to say, but we're going to say thank you very much for being here.
All right, thank you. And I look forward to seeing you guys on the Mental Wellness Chat.
I want to, of course, thank our sponsors again, who we couldn't make this program happen without them. So we have Viatris, Sandoz, and Novartis, and let's all thank them. And I want to thank you all for being here.